This is an overview of the autonomic nervous system, the physiology and pathophysiology. And this is to help you prepare to learn about the drugs that affect the autonomic nervous system. You should view this video prior to class, and you should also use it along with your textbook to understand how the autonomic nervous system works. So the nervous system has two separate branches: the central nervous system, which encompasses the brain and the spinal cord, and the peripheral nervous system, which encompasses the somatic nervous system, which innervates the skeletal muscle and is responsible for voluntary movement, and the autonomic nervous system. The autonomic nervous system is responsible for involuntary functions of the body and includes two branches: the parasympathetic or cholinergic branch and the sympathetic or adrenergic branch. And the sympathetic branch has multiple receptors. It has alpha receptors, beta receptors, and not shown here, it also has dopaminergic receptors. So there are two divisions of the autonomic nervous system. The sympathetic nervous system, abbreviated SNS, is also known as the adrenergic nervous system, and the parasympathetic nervous system, abbreviated PSNS, which is also known as the cholinergic nervous system. The sympathetic nervous system stimulates the fight or flight response. When the body is threatened or in trouble or under stress, the sympathetic nervous system kicks in and makes the body ready to respond, either by fleeing from the situation or fighting the situation. So the pupils dilate to let more light in, the heart rate increases, the cardiac output increases, the trachea and the bronchioles dilate so that we can get more oxygen to the major organs. Glucose is released from the muscle cells, and insulin is released to get the glucose into the tissues that need them to function well. The functions of the GI tract and the urinary tract are diminished so that you don't have to worry about running to the bathroom while all of this is going on. Now, on the opposite end of the spectrum, we have the parasympathetic nervous system, which is the rest and digest system. This is what allows our body to relax and restore and refresh itself. When the body doesn't need all that extra oxygen and all that extra energy, it slows things down. So the pupils constrict so that we get less light coming in. That allows melatonin to be released, which tells our brain to put us to sleep. The trachea and the bronchioles constrict because we don't need as much oxygen coming in. The blood vessels relax because we don't need the elevated blood pressure. The coronary arteries constrict because we don't need as much oxygen supply to the coronary artery. The GI glands start to produce more secretions, and GI motility increases to aid digestion. The bladder contractions increase so that the bladder can be emptied. So to sum that up, the major actions of the parasympathetic nervous system are the cholinergic nervous system. Pupils, arteries, trachea, and bronchioles constrict. Heart rate and myocardial contractility decrease. And GI motility and bladder contraction increase. On the opposite side, major actions of the sympathetic or adrenergic nervous system: the pupils, arteries, trachea, and bronchioles increase or dilate. The heart rate and myocardial contractility increase. And GI motility and bladder contractions decrease. These two systems can have complementary or oppositional actions, but they work together under normal circumstances to maintain homeostasis. So as one system increases, the other system monitors and has opposing effects when necessary to keep the body on an even keel. Sort of like these men using the two-handed saw, they're pulling and pushing against each other in opposite actions, but they're working toward the common goal of sawing that log in half. That's how, under normal circumstances, the cholinergic and adrenergic nervous systems work. Oppositional actions working toward the common goal of homeostasis. Now, catecholamines are substances that can produce a sympathomimetic or parasympathetico-mimetic response. They can be either endogenous or synthetic. Neurotransmitters are catecholamines that transmit impulses across synapses between neurons and an effector. In the body, neurotransmitters are synthesized and stored at the terminal nerve endings. They're released and diffuse across the synapse and bind with the receptor to create a physiologic effect. Over time, that bond is released and the neurotransmitter returns to the terminal nerve ending, where it undergoes reuptake and recycling to be used again. The adrenergic neurotransmitters, we have endogenous, which are produced in the body, and those are epinephrine, norepinephrine, and dopamine. And we also have synthetic, which are dobutamine and phenylephrine. Now, the endogenous neurotransmitters can also be administered exogenously as medications in addition to what the body produces. And then the cholinergic neurotransmitter as acetylcholine. Now, the drugs can act in a variety of ways. Drugs that we give can be direct acting. That means that there is no action of the actual endogenous neurotransmitters. The drugs themselves bind directly with the receptor and cause a physiologic response. The indirect acting drugs act on the terminal nerve endings to cause the release of the catecholamines from the storage sites, which then cross the synapse and bind with the receptor to produce the physiologic response. And then some drugs are mixed acting. They work directly on the receptor site, and they also indirectly stimulate the receptor by causing release of the stored neurotransmitter. So now let's talk about the sympathetic or the adrenergic nervous system. This is our fight or flight system. Adrenergic receptors are located throughout the body, and they are the receptors for the sympathetic neurotransmitters. That's norepinephrine, epinephrine, and dopamine. Alpha adrenergic receptors include alpha 1 and alpha 2 receptors. Beta adrenergic receptors include beta 1 and beta 2 receptors, and dopaminergic receptors respond only to dopamine. The drugs that we give for this system may be selective, meaning they work only on one particular type of receptor. They may be non-selective, meaning they work on all alpha and beta receptors throughout the body and have a systemic effect. And they can be an agonist drug, meaning they stimulate a response, or they can be antagonists, meaning they block or inhibit a response. The alpha adrenergic receptors, alpha 1 adrenergic receptors, respond to neurotransmitters and stimulate an effect. And these are in the eyes, the blood vessels, the bladder, the male sex organs, and the prostate gland. And they cause vasoconstriction and smooth muscle relaxation. The alpha 2 adrenergic receptors are located in the terminal nerve endings, and they control the release of neurotransmitters and shut off the release of excessive epinephrine. The beta adrenergic receptors are located on the postsynaptic effector cells. Beta 1 adrenergic receptors are located primarily in the heart and the kidneys. They increase the force and rate of myocardial contraction, and they stimulate release of renin from the kidneys, which then activates the renin-angiotensin-aldosterone system. Beta 2 adrenergic receptors are located in the smooth muscle of the bronchioles, the arterioles, and the visceral organs, and they're responsible for bronchial dilation, release of stored energy, which is also called glycogenolysis, and release of insulin, skeletal muscle contraction, and dilation of smaller arterioles. Now, the dopaminergic receptors are stimulated only by dopamine, and they cause dilation of certain major blood vessels, which results in an increased blood flow to those organs. So the renal arteries dilate and increase blood flow to the kidneys. The mesenteric arteries supply the abdominal organs. The coronary arteries supply the heart muscle, and the cerebral arteries supply the brain. So how do these things respond to stimulation? Well, it's too much to go into in this PowerPoint, so refer to the table on page 8 on table 18.1 on page 296. That will give you the details of how each organ system responds to stimulation of the adrenergic nervous system. Some common indications for adrenergic drugs include shock, hypotension, inadequate tissue perfusion, particularly cardiac and renal, asthma, especially severe acute symptoms, and nasal congestion. Now, the parasympathetic nervous system is also known as the cholinergic nervous system, and this is our rest and digest system. A good way to remember the effects of the cholinergic nervous system is the acronym SLUDD. When stimulated, salivation increases, lacrimation increases, bladder contractions increase, causing urination, GI secretions and GI motility increase to aid digestion, and lower GI tract peristalsis increases to aid in defecation. We also have constriction of the pupils, dilation of the arteries, and an increase in secretions like sweat and mucus. The cholinergic neurotransmitter is acetylcholine. And cholinergic drugs act on the parasympathetic nervous system to either stimulate or block cholinergic effects. If they stimulate cholinergic effects, they're called cholinergic agonists. If they block cholinergic effects, they're called cholinergic antagonists. Cholinergic receptors are of two types, nicotinic receptors and muscarinic receptors. Nicotinic N receptors stimulate the release of epinephrine. Nicotinic M receptors are active in skeletal muscle contraction. Muscarinic receptors are the ones we'll talk mostly about in the upcoming chapters, and those are responsible for vasodilation and decreased blood pressure. Cholinergic drugs are used mainly for their therapeutic effects on the gastrointestinal and genitourinary tract, the skeletal muscle. We use those in people with myasthenia gravis. In the eyes, we can use these to treat glaucoma. And in the central nervous system, they can be used to treat the symptoms of Alzheimer's and other types of dementia. So all of these organs are affected by the autonomic nervous system. If you have any questions about the information in this video, feel free to post them to the Q&A forum, or you can email them to me and I will respond to them on the Q&A forum. I hope this was helpful.